I call this meeting of the Human Services Policy Committee to order. Members, please take your seats. We do have a quorum. The first item of business is the approval of the minutes. Representative Keel.
Chair Fisher, I will move the minutes of, what day is this? February 27th.
Thank you, Representative Keel. Representative Keel moves approval of the February 27th, 2023 minutes. Are there any questions or amendments? Hearing none, all in favor of the approval of the minutes from February 27th, 2023, signify by saying aye.
Aye.
Opposed? Motion carries. The minutes from February 27th, 2023 are approved.
Yep.
First, members, just let you know we have a very full agenda today. We are going to be, we've got a number of bills this afternoon, and then we're coming back this evening with a few more. So we are going to be making sure that we are keeping things moving along. We've got maybe about 10 to 15 minutes for each presentation, and we'll probably be having testifiers limiting their remarks to about 3 minutes. So just want to make sure people understand what we have happening. We'll begin with the first House File 2099 from Representative Richardson. Since Representative Richardson is not a member of a committee, I will move to refer House File 2099 to the State and Local Government Finance and Policy Committee. So welcome, Representative Richardson. Thank you for being here today. Looking forward to hearing about your bill.
Thank you, Mr. Chair. House File 2099 would establish a task force on pregnancy, health, and substance use disorders to establish uniform standards for providers administering toxicology tests, develop requirements for reporting prenatal exposure to controlled substances, provide recommendations for increasing access to family-centered substance use disorder treatment services, and evaluate the effectiveness and provide recommendations related to involuntary civil commitments during pregnancy. This work builds on bipartisan work that was accomplished 2 years ago by my former colleague, Representative Kelly Morrison, now Senator Morrison, that made needed changes to our state's mandatory reporting laws regarding substance use disorder in pregnancy. The changes allowed providers discretion as long as the patient was continuing their prenatal care and working a care plan with their provider, which included coordinating treatment options, other healthcare needs, and social services. The changes were needed as Minnesota had some of the most punitive laws regarding substance use disorder during pregnancy, and studies have shown how more punitive laws worsen health outcomes. Mandatory reporting of controlled substance use after prenatal screenings leads to distrust of providers and avoidance of prenatal care during pregnancy. Studies show that prenatal care with a trusted provider greatly reduces the negative effects of substance use during pregnancy, including decreased risks of low birth weight and prematurity. Drug enforcement policies that deter people from seeking prenatal care do harm. Creating discretion in reporting was an important step forward, and it's clear that our health systems would benefit from uniform guidance on standards. There are long-standing disparities, even though usage rates for substances are similar among groups. Studies show that Black and Indigenous individuals and low-income individuals are more likely to be tested. This bill would bring together healthcare providers, law enforcement, social workers, county attorneys, substance use disorder providers, and other stakeholders to produce a report to the legislature on financially sustainable treatment options that can preserve families struggling with SUD. As a state, we hardly have any options for families that are struggling with the disease of addiction, and there are some really important treatment options and innovations that are available around the country that are preserving families while providing treatment for parents and counseling for the whole family. Seeking prenatal care should not expose a woman to criminal or civil penalties such as incarceration, involuntary commitment, loss of custody of her children, or loss of housing. These approaches treat addiction as a moral failing, and we know better now. And when we know better, we must do better. And I know that Minnesota can do better. I do have testifiers that are here today to testify in support of the bill.
Thank you, Representative Richardson. The first testifier I have listed is Kristen Huffman. If you'd like to come forward, introduce yourself, and begin your testimony, please.
Mr. Chair and members, my name is Kristen Huffman, and I work as a program manager at Hennepin County.
I want to thank the committee for allowing me to speak today in support of Bill 2099. As a woman, a mother of 3, a program manager who oversees all of the reports of prenatal exposure, and a 20-year veteran in child welfare work, it is my testimony today that multidisciplinary guidance is needed around the intersection of child safety, maternal child health, and substance use disorder. The state of Minnesota has recognized that reporting pregnant patients with substance use disorder creates a disincentive for those patients to engage in prenatal health care. Last year, legislation was passed which allows for prenatal health care providers to forego their mandate to report pregnant patients with substance use disorder to Child Protection if those patients are engaged in their prenatal care. While this legislation is a positive step forward in prioritizing maternal child health and well-being, it hasn't prevented mothers from being tested and reported on at birth by outside providers or hospitals. In Hennepin County, there has only been a 20% reduction in reports regarding prenatal exposure to alcohol or controlled substances since this legislation went into effect. Additionally, the racial disparities and disproportionality related to reports on mothers with substance use disorder are staggering. In Hennepin County in 2022, a mother identifying as multiracial, where at least one race was Black or African American, was 7 times more likely to be reported on than a white mother. If the mother is Indigenous, that number jumps to almost 37 times more likely to be reported. To better support and partner with families, recommendations are needed around many aspects of maternal child health and substance use disorder. To name just a few, we need to know more about specific substances and their different impacts on the fetus, the accuracy of toxicology testing, the impact of substance use disorder on the family system, as well as considerations of parent-infant attachment during treatment. Additionally, we need to hear from parents that have been involved with child protection systems to ensure that interventions around child safety and substance use disorder aren't setting parents up for failure. And finally, we must have voices from the communities representing those groups with disparate outcomes, holding professionals accountable for creating recommendations that make sense when viewed through a racial equity lens. The creation of a task force on pregnancy health and substance use disorder is the natural next step in continuing to support pregnant patients and their infants, while also developing measures to ensure child safety without unnecessarily involving families with the child protection system. The recommendations for the diversity of task force members will allow for important voices to be heard across the continuum of child and family health and well-being. Hennepin County Child Protection is excited to improve our best practices for parents and their newborns. I strongly encourage the committee to pass Bill 2099. Thank you.
Thank you for your testimony. Next, I have Dr. Abby Montague.
Montague.
Thank you for correcting me.
Thank you, Mr. Chair and members of the committee. My name is Dr. Abby Montague, and I've worked at Hennepin Healthcare Newborn Nursery for the last 5 years as a pediatrician, and I am a medical toxicologist serving the tri-state area with the Minnesota Poison Control System. And as an expert both on newborns and on drugs, I have spent the last 4 years of my practice learning and educating about the main concern of this bill before you, substance use in pregnancy. And what I've discovered is that on the very first question we ask, who to screen, there has never been a consensus, research-based guideline. What is clear, and undeniably so, as my fellows here have testified, that in practice, drug testing and reporting to CPS is full of bias. When everything else about their pregnancies, lifestyle, and income are the same, Black women are still screened twice the rate as white women in some other studies, and clearly it's worse in our own county. This is why I'm here, and that's why this bill came to you. And I see these effects of our reporting system on new parents in my practice at Hennepin. Roughly 80% of the women who give birth in our system are on Medicaid, and the majority are women of color. As their physician, I'm honored to say happy birthday to a baby for the first time and see new parents discover how much you can actually love your child. And I see people who have a substance use disorder, and they are terrified to talk to their doctors about it or come to the hospital for fear of how they'll be treated. For example, I met a 30-something mom who in her 20s had a meth use disorder and had her first 2 children taken away from her. She went to treatment, had been sober for 10 years when I met her. Her life was completely different. But the first time she sought care for her pregnancy was at the delivery because she was terrified her substance use would be held against her and this child would be taken too. She was scared to even talk to me because of this fear. Prenatal care education and supportive programs improve outcomes in both the infant and the mother, but the fear of having a child taken away is a barrier to all of it. My colleagues and I were thrilled with the 2021 legislation that lifted the mandated reporting requirement. However, there was some nuances that we didn't anticipate when that bill was changed. For example, that law was changed, but the toxicology testing statute was not changed. So with the interpretation of our hospital lawyers, we were told we were still required to test and report infants even for exposure to marijuana in pregnancy. And this sowed confusion amongst providers and healthcare systems. So a mom at one healthcare system may be tested, treated, and reported, while at another healthcare system she wouldn't for the same exposure. It really undermines the trust that my colleagues have built during entire pregnancy when they tell a mom, yes, tell me about your marijuana use disorder, we'll talk about it, you won't be reported, and then I come in on their baby's first day and say, I'm sorry, yes, I'm reporting to CPS. It completely shatters that trust. I've spoken to providers at Fairview, at Maple Grove, at North Memorial, at Alina, and even Duluth about who should we screen, what are you doing, how can we do this better, and we're all trying to do the same thing, and we don't know what to do because there's no good answers. There are no national guidelines, and there won't be because the state policies around requirements for testing and reporting are so different. We need to do this for our own state. The bill before you will create this task force to look at maternal health and substance use and establish uniform guidelines on when both moms and babies are tested and reported. This bill is absolutely necessary to address the racial disparities in reporting to child protection. This is a really complex issue. We do the tests and reporting in the hospital, but it involves so many players outside of that. I am responsible for our hospital's guideline, and I don't have the input from everyone in the community that it affects. This task force would allow us to get all the players at a table to do what's best for moms and babies in Minnesota. Thank you.
You're welcome. Thank you for your testimony. Is there anyone else from the audience that would like to testify on this bill? Okay, hearing none, we will go to members. Representative Baker.
Thank you, Mr. Chair, and Representative Richardson. Good bill. Thank you for bringing this to us. One of the things that I learned setting up our ORAC council, the 19-member council, is some things that worked for us is making sure that you have folks on this advisory council that are people in recovery. I think you do have a person, I think, on here too, which I looked it over. Also, bring your meetings. They should also meet at least 50% of the time in greater Minnesota. Get to the reservations, get to the other parts of the state that need to see us do this work here. So I hope that that could be a change that you actually put into your rules about where they will meet, because again, this is really important stuff. It is delicate, and we did some good things a year ago, but we didn't get it all right. You're exactly right. So mandatory reporting of this stuff is really a tricky slope, but we have to make sure moms feel comfortable coming in, getting the prenatal care that they need without the big hammer. But there are consequences too, though, and we have to not just like ignore that. So it's a delicate thing. I think the advisory council is exactly the way to approach this. Thank you for bringing this forward.
Thank you, Representative Baker. Representative Richardson, any comments?
Thank you, Mr. Chair, and thank you, Representative Baker, for your comments. I think you're absolutely right about ensuring that there is connections across the state and being able to connect not only with tribal communities, but understanding that substance use disorder is touching every single county, and so your point is well taken there as well. And I'm a firm believer in compassion and accountability, and I think that this bill is a pathway there.
Thank you, Representative Richardson. Seeing no other comments or questions, Representative Richardson, would you like to offer closing comments?
Please support the bill.
Awesome. Thank you. I like that short discussion there. I renew my motion to refer House File 2099 to the State and Local Government Finance and Policy Committee. All those in favor signify by saying aye. Aye. Opposed, say nay. Motion prevails, and House File 2099 is referred to State and Local Government and Finance Policy Committee. Thank you, Representative Richardson, and to your testifiers. Our next item on the agenda is a presentation for the Department of Human Services. This is to give us more information on the background studies and the Background Study Eligibility Task Force. We are hoping to keep this presentation about 15 minutes or so, and this is going to help set the stage for a couple of bills that we have coming up. So, Deputy Inspector General Davis, please come forward. Welcome to the committee. Thank you for taking the time to be here today.
Thank you.
If you'd like to introduce yourself and then we can get started with your presentation.
Okay. Mr. Chair, members of the committee, thank you for the invitation to speak today. My name is Dawn Davis. I am the Deputy Inspector General for DHS's Background Studies Division and also serve as oversight of DHS's statewide background studies system. So as we get started today, the presentation will cover 4 topical areas. They are an overview of DHS's statewide background studies system, the governor's 2023 background studies proposals, and then overview of the background studies eligibility task force, and then task force recommendations. DHS's background studies system contributes to protecting Minnesota providers' workforce, fraud prevention, and legal compliance. DHS conducts background studies for over 60 provider types, including more than 35,000 entities, with many having unique and distinct study requirements. Background studies are vital pre-screening processes intended to safeguard children, vulnerable adults, and others who receive health care and human services. A study determines whether a person has committed an act that would disqualify them from being employed or providing services that do require a background study. A background study is more than a background check. It requires a thorough review of information from multiple sources. I'd like to also just share really quickly, the state and federal data privacy laws also prohibit the types of information that can be shared about a disposition of a study or the status of a background study. And some of the databases that we search include a couple of the following, just to highlight: Minnesota Bureau of Criminal Apprehension, Minnesota Predatory Offender Registry, Minnesota Social Service Information System, SSIS, and then also certain background study requirements at the federal level require searches from the following databases: the FBI, National Crime Information Center, National Sex Offender Registry, Minnesota Licensing Boards, Minnesota Nurse Aid Registries, as well as the Minnesota Office of Inspector General Exclusion List, as well the Federal Exclusion List. Those records then move us forward at DHS to the next steps of requesting records from law enforcement, courts, and other agencies in Minnesota and in other states. DHS also receives automated real-time updates of state criminal information from the Minnesota Court Information System. A check of the National Child Abuse, Neglect, and Registry is required for certain study types when an individual has lived outside of the state in the last 5 years or currently does live out of state. Wanted to bring forward some information just to kind of share a chart that would provide actual number of background study applications to give you a sense of the number of applications that DHS has received over the last 5 years and each year. Since the return to full compliance fingerprint-based studies in September of 2021, DHS received just over 500,000 applications last year alone, creating some stress on DHS's statewide background study system. Over time, it has been challenging for our staffing complement to keep up with the increasing numbers of applications, the pace, and the complexities inherent in the type of work that we perform. DHS's background studies process. The background study process is automated, it is multifaceted, and it is thorough. In 2014, Minnesota legislature passed and the governor signed into law authorizing the use of NetStudy 2. DHS uses NetStudy 2 as its web-based system for background study requests, and it also receives and processes applications and records. Study subjects complete the fingerprint requirement through the DHS-approved fingerprint and photo services vendor to check information against other records, including FBI databases, some of those that I mentioned earlier. Approximately 85% of background study determinations are made within 24 to 48 hours. In some cases, more time is needed to complete the study because that information may need to be acquired or obtained from other states, other law enforcement agencies, as well as in-state. I also wanted to mention here that the Net Study 2 system is our advanced system that is used by over 35,000 entities. And I mentioned that on one of the earlier slides. We use the fingerprints to check state and federal criminal history records, which provides vastly improved data matching. Net Study 2 includes an applicant portal that does enable study subjects to enter their information as well when working with providers to complete or submit their study. The system uses a robust and complex logic that meets the FBI's criminal justice information system requirements, and Net Study 2 issues background study determinations immediately after receiving a response from the state criminal history system when there is no information found that requires additional checks. The background study system appeals process. So we do have an appeals process and reconsideration process in place. All study subjects who are disqualified do have the right to make an appeal for reconsiderations of their determinations. Disqualified study subjects may appeal the determination if the information used to disqualify is incorrect and/or the individual does not pose a risk of harm to people receiving services. Included in the disqualification notices is information about how a person who is disqualified can challenge their disqualification. Also want to mention that state and federal laws specify the acts, offenses, and duration of disqualifications that prohibit a person from working in specific licensed and regulated programs that have access to people served or when providing direct contact services. A comprehensive list of those disqualifications can be found in our Minnesota statutes, Chapter 245C.14 and 245C.15. At the request of the study subject, all disqualifications, including a risk of harm, can be reviewed, and study subjects may offer additional information. They can bring that forward. Included in disqualification notices is information about how that individual can go about how they are able to challenge their disqualification. If the disqualification is set aside, the study subject is allowed to work. However, in some instances and with certain provider types, a study subject may be allowed to work while the appeal is being processed. There is also some flexibility within the system, but we also focus on balancing safety with employment and provision of services. Our governor's 2023 background study budget proposals really sort of focus on three core areas, and they have moved forward this session. They are covering our operations. We have information that funds critical background studies positions that support Minnesota's workforce and the safety of children and vulnerable adults. It improves engagement with and supports our providers and our ability to engage with those providers who submit background studies. 245C statutory changes, that is another area of proposal that brings Minnesota into compliance with federal regulations on data sharing, and also plans for the development of an electronic process for requesting reconsiderations and submitting appeals. And then lastly, the background study fee update. We have a proposal in that increases the background study fee by $2 to account for a transaction fee increase. And that grants DHS the authority to increase fees by the amount the BCA increases in the future. Lastly, it allocates general funds to cover the cost of initial background studies for adoption, for tribal background studies for adoption and child foster care. The Human Services Background Study Eligibility Task Force in 2021, the legislature established the task force to review statutes related to background studies eligibility and disqualifications. That consisted of more than 20 members on that task force, representing a variety of backgrounds and areas of expertise. DHS and MDH both had one representative each, and we also provided technical assistance and data to the task force. That task force also moved forward to develop 4 of their own distinct subcommittees. Those were disqualification committee, a remedies committee, a data committee, and a data analysis committee. They met from October 2021 through December 2022, and all of those meetings were facilitated by the Legislative Coordinating Commission, which submitted an interim report on March 1st, 2022, and then a final report on December 16th, 2022. Task force recommendations. The final report includes a total of 19 recommendations, and those can be found on the Legislative Coordinating Commission's web pages. I wanted to highlight at least 6 of those recommendations here for reference. And so they include modernization of the technology through creating a web portal for the entire background study and reconsideration process, updates to the current IT infrastructure at DHS to improve data retrieval, creation of a public dashboard that provides regular reports on background studies processes and data, standardization of the timeline to request reconsideration, statutory codification of a requirement for DHS to provide a list of community resources to which a disqualified person and the prospective employer can obtain legal advice regarding their study and the disqualification. And then lastly, statutory changes that would create efficiencies that allow for traveling set-asides. And at this time, I just want to mention that DHS is reviewing those task force recommendations and consulting with legislators, stakeholders, the commissioner at DHS, and others about specific recommendations and where we can make progress for this legislative action.
Thank you, Deputy Inspector General Davis. I do have Representative Baker. Go ahead with your questions.
Thank you, Mr. Chair, and thank you, Inspector General and DHS for this review, and all the members that served on the task force. It had to be a lot of work. It is long, I shouldn't say long overdue, but it's overdue, and I think I call my friend Matt Burdick a lot to talk about concerns and issues that I have with constituents at home. So there's a lot of good recommendations here. I'm looking forward to hearing Rep. Edelson's bill coming up today. And I think the part of it that was wasn't sure if this is part of the recommendations yet or not, but when there is a set aside and there's a flag that's been flagged to this individual, it's how we deliver that news to that individual that's it's critical, so they don't just give up, throw up their hands. I can't do this anymore. A lot of times it's people in the recovery community that's doing amazing work and has been for quite a while. So I think that our recommendations will be better as it goes forward, some of the things that Representative Edelson is bringing forward. But I'm just, that part of it has my biggest concern about how we go forward and how we deliver that message to these people that have something in their background. But the part that I still feel is missing here is how can we get the employers, the licensed employers, the licensed providers that are providing the service, how can we get them to share in this responsibility and the role that they play to keep these people in the workforce with maybe understanding the flag, and how can they be a partner in this instead of being a victim as well by they can't have these employees alongside of them? Is there a role for the employer in this situation?
Mm-hmm. Deputy Inspector General Davis.
Mr. Chair, thank you, and members of the committee again. Yes, we do share that same sentiment. Want to have those providers, as well as, because they are employers in many cases, have some of that responsibility. And so we will take that under advisement and bring it back to look at how we can put into place communications that help providers understand where those flags are to be able to communicate back out to that study subject or that individual that they are trying to hire or bring on for the provision of services. Thank you.
Thank you, Representative Baker. Representative Hicks.
Thank you so much. Thank you so much for being here and for that presentation. And I'm looking forward to some of the bills as well. I do just have a question about capacity within background studies to respond to concerns. So when we get concerns, we run it up the chain and those concerns are addressed. What I hear from providers and folks in my community, and to be fair, primarily those concerns are around the contracting agency that is being utilized. What I hear is, I sat on hold for 2 hours with the net study people. I sat on hold and then I got disconnected. I called 7 times. I had one person who told me they sent a certified letter to Anderson because they could not reach anyone. So can you help me understand what capacity within that study within DHS to provide provider support looks like? And if appropriate or if needed, what is kind of in the proposals to increase that capacity to allow people to respond in a timely fashion?
Deputy Inspector General Davis.
And I'm going to turn to my colleague here, Matt, to see if he can help with answering some of that information.
Mr.
Thank you,
Burdick.
Mr. Chair.
Thank you, Mr. Chair. For the record, Matt Burdick with the Department of Human Services. And thank you for that question, Representative Hicks. As one of the people that gets the emails when you all have these, I'm acutely aware of the challenges that are being faced out there. And that's exactly why the budget proposals that you see before you that Inspector General Davis talked about is what we need to do. We've seen a real explosion in the volume of background studies we've seen, and our staffing has not kept pace. And that's a theme you're hearing from Commissioner Harpstead in a whole lot of areas, but this is a very tangible operational space where it is needs highly trained people. As the Inspector General explained, there's a lot of complexity to these cases, and it requires pretty in-depth legal review. And oftentimes where you're hearing these cases are those ones where it doesn't just sail through in 48 hours. It's where there are a need for a human being to go through and do that review versus that check. And that's where it slows down. And so even getting those resources, it takes time to train people into this. Another piece of this that the task force is talking about and that Representative Edelson's bill, I think, gets at is we need to reduce the complexity of the background studies regime. Part of the challenge here is that we've got so many different types of studies that no 2 studies look alike. And you could be applying for 2 different jobs at the same time and have radically different study requirements. And so how can we streamline some of that so that it doesn't take someone 20 hours of work to review a single case? And then also how can we staff up our call centers and all those rests so that we have people getting answers in a timely fashion?
Yeah. Thank you. Thank you, Representative Hicks.
Yes, thank you. And I just wanted to say that I really appreciate that. And I think one of the things that sometimes we forget about in these spaces and in these tables is that we can't solve problems without people. And so we need to make sure that we have the people power to solve the problems. So thank you.
Thank you. And then for the last question, we'll be going to Chair Noor, and then from that, we'll be going on to our next bill. Chair Noor.
Thank you, Mr. Chair. To Matt Burdick, probably. When we have expunged records, because we see that often, and also sealed records that end up appearing on the net study, how are we handling that?
Deputy Inspector General Davis.
Yes, thank you, Mr. Chair, and thank you, Representative Noor. One of the ways in which we handle that is that information comes in when a person has requested or filed for an expungement. That does come into our legal team. So they're the first touch on those. And then I'm brought in to review with the legal team as they pull together their information. We do look to determine whether or not that person has ever had a background study in DHS. In some cases, they have not. Or with MDH or any other state agency that is working with vulnerable populations. And so there is a process that is in place, protocols that are in place to review expungements and to make a determination whether or not. We work also with the Attorney General's office. They actually file on behalf of our legal team. And so we would have to reach across the aisle and work with the Attorney General's office before we're able to object to any of those expungements or as we're reviewing them.
Chair Noor.
Just a quick follow-up, Mr.
Okay.
Chair. Deputy Inspector General Davis, the situation where we have someone who's applying to work in the kitchen or other places where they don't even interact with the individuals who are in a setting, that they tend to be locked out because they cannot work in any setting that they have license through DHS or MDH. What are we doing with instances whereby they've got expunged records or somehow there's information SSIS and other places that may not be fully vetted, that we deny them that opportunity to be able to work in that setting?
Deputy Inspector General Davis.
Mr. Chair, and thank you, Mr. Noor, for the question. That question has a level of complexity to it. I will say that we do share your sentiment and that our intent in DHS's background study system is not to lock people out of jobs. However, there are certain state and federal laws. It depends on the provider type and the specific law for background studies that we would have to follow. And so it's hard to give a general answer without sort of knowing more detail. But I do hear you. I am listening and hear what you're saying and appreciate your question.
Thank you, Chair North. Okay, thank you, members. Thank you, Deputy Inspector General Davis, for being here today. Appreciate it. We will now move on to House File 753 from Representative Frazier. Since Representative Frazier is not a member of the committee, I will move House File 753 to be re-referred to the Human Services Finance Committee. Representative Frazier, welcome to the committee. Please introduce your bill.
Thank you, Mr. Chair, Vice Chair, members. Appreciate you for giving me the opportunity to be here to talk about this. And I thought it was very good that you lined it up that I'm right after the presentation before me. It's helpful. No, I truly mean that. It's not as a joke. It's helpful because they reference the background study task force. And what this bill is about, House File 753, it's about addressing some of the recommendations that came from that task force in the report from December of 2022. And particularly, let me start this way. Let's see. So in Chapter 260B.002 is the state's policy on disproportionate minority contact. It is the policy of the state of Minnesota to identify and eliminate barriers to racial, ethnic, and gender fairness within the criminal justice, juvenile justice, corrections, and judicial systems in support of the fundamental principle of fair and equitable treatment under law. What the task force found in their findings was that based on the discrepancies and the disparities for eligibility when folks are screened out when they have these background checks is that we are not in alignment with that mission and with that policy. What they found were specific disparities of black and brown individuals that are going through these background checks in regards to the representation of their populace and the census data versus the screening out of these individuals when they go through these background checks. So that's why we're here. This bill, House File 753, will address that. In a sense, what it does is any of those individuals that have expungements, and those expungements have been communicated to the Department of Human Services, they cannot use that information to use it as a screening out mechanism for those particular individuals. Currently, DHS has the ability to look back even when the records are expunged. This is for juveniles. Currently, they have the ability to look back even when those records are expunged and use that information to make those determinations. What House File 753 would do would close that spigot off, therefore bringing down, and the idea is to eliminate some of the disparities that we have. Mr. Chair, I did not bring testifiers today, and the reason I did not is because the presentation that was before me that referenced the recommendations, I think many members have seen the report. I think it speaks for itself. What we're trying to do is eliminate some of these disparities and be in line with Chapter 260B.002.
Thank you, Representative Frazier. Is there anyone from the public who would like to testify? Not seeing any. Members, are there any questions or comments for House File 753? Representative Backer.
Thank you, Chair, and thank you, Representative. I don't know if you would know this answer, but how often or how much do you think this is going to be needed so services can be provided? Do you have any idea, or maybe for someone from that served on the task force, is this happens 30 times, 40 times, 100 times? It'd be interesting to see that segment of that population that we want to serve better.
Representative Frazier.
Thank you, Mr. Chair, Mr. Backer. I don't have those specific numbers, but if there are any, we do. Wait, I know they exist. I just don't have them with me right now. Is there anyone staff from DHS that may have?
We're phoning a friend, and I don't see.
And if you want to email. Email me,
I will do that.
Representative Frazier. I'm sorry, Chair.
Yeah,
Sorry,
Chair. Representative Backer, go
Thank
ahead.
you. Yeah, if Representative Frazier, if you want to email, or we see each other on the House floor. It'd just be quite interesting, with my background as EMS, you know, we don't necessarily come into those challenges. We come into other challenges, and maybe I can learn from that so we can help a different segment of the marketplace or of the clients being served. Thank you.
Thank you, Representative Backer. Next, we'll go to Chair Noor and then Representative Finke.
Thank you, Mr. Chair. Thank you, Representative Frazier, for bringing this bill forward. I think I specifically addressed a little bit about the components of your bill. We have seen a significant number of people who've been excluded, specifically because of the background studies. And so with the workforce shortage we have, and to be able to find a job so that people can find a living wage, this is a moment that we need to look at every place there whereby individuals who have not committed any major crimes, that they're able to find a job within the department, settings that we can allow them, because we want to take care of everyone. And we don't want to exclude people just simply because they committed minor crime while they were kids. Sometimes it's something that was expunged, the record is sealed, yet we may end up using that against them. So thank you for bringing this bill forward.
Thank you.
Thank you, Chair Noor. Representative Finke, and then we'll be going to the vote.
Thank you, Chair Fisher and Representative Frazier, for bringing this bill. I did want to just make sure I was understanding this correctly. I was already having this thought during the presentation, and it felt to me like we were saying, I looked up the list, right? This is why we disqualify people. That's a quantitative list of offenses. But then we have a policy that allows a qualitative assessment of a person's record even after expungement. Is that the current system, where somebody gets to make a judgment about whether or not to take them off the list, but they don't get to make a judgment about whether or not they go on the list?
Representative Frazier?
Can you repeat the question, Representative?
Representative Finke.
I mean, I'm not trying to be cutesy. I'm just asking, like we have a list of offenses, and if you have committed one of these offenses, you go on to the DQ list. But if you have an expungement, you don't get off the DQ list. Someone has to make that decision for you. Is that how it's currently set
That's
up?
correct.
Yeah. Okay.
Representative Finke.
Thank you. I just wanted to make sure I was understanding that correctly, because that seems wildly unjust. And so thank you very much for bringing the bill, and I'm glad that we can correct that.
All right, thank you, members. Seeing there's no further discussions, Representative Frazier, would you like to make closing comments?
Just, I think, to the point that Representative Finke just made, it is time to make this change. The task force was put in place to specifically look at where we have some weaknesses, ineffective areas, or disparities, and I think they pointed them out quite well. I mean, they're glaring, so they're there, and I think it's time for us to make those changes. So I would like to support on this bill.
Thank you, Representative Frazier. I renew my motion to refer House File 753 to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Opposed signify by saying nay. The motion prevails, and House File 753 is referred to the Human Services Finance Committee. Representative Frazier, thank you for bringing the bill. Next on the agenda is House File 1172 from Representative Edelson. Representative Edelson, if you'd like to come down to the table here. I see you're getting set up. And if you'd like to move your bill. And I will also mention, I know that to keep on, we've got several testifiers, so when the testifiers come up, we want to make sure to keep about 3 minutes each. So Representative Edelson, if you'd like to go ahead.
Thank you, Mr. Chair. Yes, I would like to move House File 1172 before the committee.
Okay.
And then once we adopt, and then I also have a DE1 amendment.
All right, super. We have a DE1 amendment. We have Representative Edelson has moved House File 1172. Representative Edelson moves the DE1 authors amendment. Would you like to explain the amendment?
Mr. Chair, if you wouldn't mind, if the committee wouldn't mind adopting the amendment, I'll explain it. It's as a larger bill.
Okay, this is to get the bill in the shape that the author would like. Any questions? Seeing none, all in favor of accepting the DE1 authors amendment, signify by saying aye. Aye. Opposed? The DE1 authors amendment is accepted, and we're back to the bill as amended. Representative Edelson, if you'd like to go ahead.
Yeah.
I understand you have an oral amendment.
I do. Just one oral amendment, Mr. Chair, today. If I could do the oral amendment, which will be striking the lines 1.10 to the end of 1.23, ending at or. And Ms. Sunderman, maybe if you just want to clarify that I have that correct. You and I had spoke about this earlier.
Ms. Sunderman, if you'd like to go ahead and clarify that for us, please.
Mr. Chair, members, the instruction should be page 1, lines 3 to 23, delete the new language, and then on page 2, it should be page 2, delete lines 1 through 5. And that would delete the entirety of section 1 from the bill.
Okay, so we're deleting the entirety of section 1 from the bill. Any questions for the author? Author, would you, Representative Edelson, if you'd like to explain?
Yes, Mr. Chair and members. So what we're doing here is we're taking out the juvenile section of the bill. We will be adding it back in. I want to make sure the legislative intent is there. I'll be adding this back in when it goes to Chair Norris Committee and Human Services Finance. There needs to be some tweaking that's done. Right now, it's a little too all-encompassing.
Okay, very good. Any questions on the oral amendment? All in favor of the oral amendment striking section 1, signify by saying aye. Aye. Opposed? The oral amendment is accepted. We are now back to the bill as amended. So,
All right.
right, wait.
Thank
So,
you.
it's just as amended. Representative Edelson, please go ahead and explain your bill.
Thank you, Mr. Chair and members. And it was very helpful to have the presentation before. Initially, to try to, I guess I'll try to speed this up a little bit. I have a long opening statement, but several years ago, I was the one that initially carried the task force legislation that had met for a year, and I want to thank all of those task force members for their incredible work on this. We do have, as Representative Frazier highlighted, racial disparities and socioeconomic disparities that happen within 245C. And really what we're trying to look at, and I want to be very clear for members, the task force recommendations are in your packet. What we will be taking is a 2-year approach to this. This year is really looking at the drug crimes and looking at theft. And then there's a few other pieces. Let's see here, issuance of dishonored checks as well. These are really what the task force found to be a lot of people were impacted by this, and this seems to be an area that we can make huge progress in this year. So currently right now, there are 4 levels of how the background checks are done, and that's misdemeanor level is 7 years, gross misdemeanor is 10 years, felony level is 15, and then there's the permanent disqualifications. The big thing that this bill before you does, 1172, is it creates an additional category, a 5th category, which is for a 5-year disqualification. And that puts all of those drug possessions, the misdemeanor theft, and issuance of dishonored checks into that category. And so that's creation that. And then I just want to make clear that theft is the top misdemeanor that was found when the task force was doing the work. 50% of misdemeanors disqualifications for the DHS background check. And to just understand that a misdemeanor theft is $500 worth of items. A gross misdemeanor theft is $500 to $999. A felony theft is $1,000. I also want to highlight drug crimes such as 5th degree possession and felony level controlled substance receive 90% of the time a set aside. So in 2018, of all of the, I think in the presentation you saw the numbers. In 2018, 7,622 people were disqualified. Of that population, 1/3 of them were requested reconsideration, and about 75% of those were approved. And if we looked at 2019, it was 12,928 were disqualified. Again, 1/3 of those requested reconsideration and 65% were approved. So the bill before you would start on August 1st of 2024 and would be a big step in the right direction. And so I guess right now I'd love to turn it over to Mr. Guffin, who he was the chair of the task force, to explain a little bit more about their work.
Okay, welcome to the committee, Mr. Greffen. If you'd like to introduce yourself and begin your presentation, please.
Thank you so much, Mr. Chair and members of the committee, Representative Edelson. My name is John Geffen. I'm the director of the Reentry Clinic at Mitchell-Hamlin School of Law. I'm also a director at the TLR Law Firm, which is a nonprofit law firm, helping people with criminal records with collateral consequences. And I was a part of and the chair of the Background Study Task Force, which participated for a little bit more than a year to put together the recommendations that I think you've probably all received. And I'm just excited and appreciative to talk a little bit about some of the items we sort of evaluated, analyzed, and recommended. Maybe the first step, though, is to talk about, and I think the department and Deputy Inspector General discusses, really the diversity of the task force. Was we wanted to have diversity of thought, experience, location. So we had judges, legislators, government, impacted individuals, silly law school professors, and a bunch of people come to the table and talk. And knowing that we didn't know everything, we brought in individuals. We brought in individuals that were experts on adolescent brain science. We brought in people who were experts on addiction, brought in people that are experts on recidivism. We talked and we listened. So you can see who was on the task force, and I was proud to be part of it and how hard everybody worked. We noticed over that year there were some significant issues that should be addressed, in our opinions. The first thing we started from was the position that protecting vulnerable individuals, adults and children, was paramount to the work that we were doing. No changes should be made that impact our most vulnerable population. But it seemed pretty clear after analysis of our state and other states and the data that our statute throws a pretty wide net. It catches the fishes it wants, but it catches a lot of other stuff. Some people might say it drained the lake, and it was unnecessary. And we realized pretty early on that this was bad for Minnesota, and this is bad for vulnerable individuals because the employers were hurt by it because they can't find the people to work the jobs. Individuals who want to work and feel a desire to be in these caregiving positions can't find the work and are excluded from it. And people receiving services are hurt. They don't have the same amount of services they would normally get because the employment's not there. And the people that we were running into had a heart for caretaking and wanted to do it. These weren't exploiters. These weren't people that were going to cause harm. So we realized that in Minnesota, we have a unique process. It's unique in the country. It disqualifies more individuals for more reasons for longer periods of time than any other state we found. The statutory scheme that was described earlier of 7, 10, 15, and permanent disqualifications is incredibly long. And again, really unheard of. In Minnesota, you don't even have to be convicted of a crime to be disqualified. The department can make a determination that based on the evidence, even if you were acquitted, even if you were never charged, even if you were charged and the case was dismissed, that it looks enough that like you did it to disqualify you. And that can again be for 7, 10, 15, 20 years. We know that federal law is vastly different. The Adam Walsh Act, which is designed to protect children, has 2 disqualification periods, a 5-year period and a permanent. The permanent is reserved for those types of offenses that are very serious. Those crimes against people, those murders, the sexual assaults, that maybe we make a decision to protect our individuals that we're going to exclude that group. For just about everybody else, there's an opportunity. And that's our federal law. We noted very on, and Professor Kammer will talk about this, there are significant racial disparities from this. Some of them are downstream, meaning we have a criminal justice system that, if you look at the numbers, has certain groups that are overrepresented. And that all that's going to come downstream to us. But there were other forms of data, that again, Professor Kammer will talk about, that shows that access from certain groups isn't 100%. We heard about the background study reconsideration request. It's all on paper, which turns it into a writing competition. And if you don't write well, or English isn't your primary language, it's difficult, very difficult. And someone talked earlier about people quitting to stop wanting to work in these jobs. The department talked about 500,000 background studies. That's a huge number. We're not talking about a few jobs, but the number it doesn't include are those thousands, tens of thousands of people who have quit and are no longer applying for jobs. They're not pursuing these because they get this piece of paper that says no. So they look elsewhere. In terms of another inconsistency, Minnesota has an expungement statute. We talked about expungement earlier. You can expunge a misdemeanor 2 years after your completion of your sentence. Gross misdemeanors 4 years, some felonies 5 years. So you can expunge these records. So we have a provision that says these, and the statute itself says that proves if you can have that extended period where you're no longer committing crimes, we're going to assume that you're safe. You're safe to work with our populations. So, and I won't get into all the changes we requested, but one of the ones that we talked about in our task force were the drug offenses. The drug offenses in Minnesota, most cases in Minnesota that involve drugs are felonies. Trace amounts of a controlled substance are felonies. So under our current law, your 15-year disqualification period begins when you complete your sentence. Let's say you have a 5-year probationary sentence. Never go to prison. 5 years probation. Then you add on a 15-year disqualification. You have a 20-year disqualification for a trace amount of drugs. In my experience, and from the task force experience, who are those great LADCs out there? They're people that have walked the walk. Those are the ones that can help. And you disqualify them for 20 years. There is a set-aside process. We're going to hear from people that talk about how difficult that process is. How oftentimes it takes longer than an employer can wait to hire you. That data that is not public becomes public. These are damaging things. Juvenile records. If a juvenile is found with, let's stick with drugs again, 16-year-old found with trace amount of drugs, in Minnesota, we treat a juvenile delinquency the same as a criminal matter in our Background Study Act. So that juvenile, whose brain isn't fully developed, may do great things for the next 10 years. You're going to be disqualified. You're going to be disqualified till you're, in the scenario we put here, you're going to be disqualified for 15 years after your probation. You're going to be in your mid-30s, and you're going to have given up. You're not going to pursue that course of education because any good educator will tell you don't pursue this because you're locked out. We certainly support the language of Representative Edelson's bill and certainly approach an idea of a two-prong approach. There's a lot here. There's a lot of work that needs to be done. And when we talked and heard about capacity before from the department, it seems like such a good idea to take some of the unnecessary things off the background study list to open up that capacity to do the work that we need to do to keep our vulnerable individuals safe. I've talked about the preponderance of evidence, and I know time is limited, so I'll be quiet. I just thank the committee and chair for your time.
Thank you, Mr. Greffen. Next will be Mr. Roy Kramer. Kamer.
You're welcome. Good afternoon. My name is Roy Kammer. I am a faculty member at Minnesota State University Mankato. I teach in our alcohol and drug studies program. I train alcohol and drug counselors. I am also an affiliated faculty member with our Center for Rural Behavioral Health. Outside of my academic appointment, I am an appointed member of the Board of Behavioral Health and Therapy, our licensing board that regulates alcohol and drug counselors, professional clinical counselors. I have worked with a number of students and colleagues who have been impacted by background studies, so I was pleased to be a part of this process. My role specifically was to chair our data analysis subcommittee. As you've probably figured out, we had a lot of data to work with, and we thank our colleagues at DHS for helping us to take a look at the data. I think what's important to note is in many cases, it was the first time that some of these data have been looked at in this way or in this magnitude. The first slide that we've featured here is from 2018 and 2019, looking at the total number of background studies. It's important to note this is not persons, this is studies. Sometimes studies can be associated with more than one individual. You can see we do a lot of studies here in the state of Minnesota. While numerous individuals are determined to be eligible, what you can see is, over 7,000 in 2018 and close to 13,000 in 2019 were in fact disqualified. And that's what we spend a lot of our time looking at. So if we can flip to the next slide, what we have here is a slide just talking a little bit about disparity. At just a very high level here, the left-hand table, the pie chart, I should say, looks at the individuals who were determined to be eligible to practice. What you can see here in green is individuals who are identified as white. We see a very large representation there in terms of eligibility. We'd hope to see things hold true and consistent in multiple forms here, but when we look to the right at disqualifications, you see fewer white individuals, and consequently what that means is more people of color who have been impacted by disqualification. We followed this disparity data all the way through everything that we did. In looking at determination of risk, we saw disparity. When we took a look at who was actually applying for reconsideration, we saw disparity. Disparity is present consistently throughout the data. I'd like to move to the next slide just to talk about another key point here. This is something that has been brought up today, but the question comes up, how often are people asking for reconsideration? How often are they applying? And how often is it granted? What you can see here looking at 2018 and 2019 is we do have a significant number of people who apply, who request that reconsideration. And when they do request, there's a significant number of people who are granted that eligibility to work. Now, there are several different ways that can happen. We've collapsed it into a single category just for the sake of simpler data display. So let me break this down just a little bit further to tell you what you have in front of you. So next slide here, Mr. Geffen, please. What we did in all cases, this looks at 7-year, for instance. One of our hopes was when we took a look at our top 10, those most common disqualifications, what we would see is in 2018, which is blue, and 2019, which is orange, we would hope to see consistency from year to year. So year over year, we'd see similar types of conduct rising to the top. And that is, in fact, the case. When you compare the lists on the left to the list on the right, you'll see a lot of those same forms of crime and conduct reappearing. Moving on to the next slide, what we did a little bit further in the data analysis is we said, gosh, when we take a look at those top 10, again, how many people are applying for a reconsideration? Then of those people who apply for reconsideration, how many are being determined eligible to work? In many cases, we are seeing 70, 80, 90+% of people who are requesting those reconsiderations are being determined eligible to work. Picture the number of hours that go into applying for reconsideration, how many hours go into reviewing those applications for reconsideration, and in the meantime, we have workforce shortages. We have people dying from addiction and other related diseases. So when we look at the frequency of people who are being deemed eligible to work after going through a fairly rigorous process, our question is, are there opportunities to protect the public and also increase workforce at the same time? I won't go through each of the following slides, but we go through the same thing, 7-year, 10-year, 15 disqualifications, to ultimately show you how frequently people who are requesting reconsideration are ultimately deemed eligible to work. And with that, I want to be brief, and we have other colleagues who are here to testify today.
Thank you so much, gentlemen, for the presentation. Next, I'll call Mr. Randy Anderson. If you'd like to introduce yourself, please, and begin your testimony.
Good afternoon, Mr. Chair and members. My name is Randy Anderson. Thank you for having me today. I'm a person living in long-term recovery, and what that means to me is I haven't used any alcohol or drugs or mood-altering substance since January 9, 2005. I'm a state-licensed alcohol and drug counselor, a peer recovery specialist supervisor, and a formerly incarcerated individual due to drug-related offenses. I could sit here today and tell you about the multiple times I've been disqualified by DHS background studies and the multiple set-asides I've had to complete. Instead, I'm going to tell you how I felt when I was escorted out of the building where my recovery journey began in 2004. And in 2016, when I was working as a full-time addiction counselor, hoping to give other men the gift that was given to me, a life free from the grips of a disease that most certainly would have killed me. It was late August 2016, and I was just settled into my chair at my desk, and my phone rang, and the division director requested that I come to his office immediately. When I got to the office, the division director and my supervisor were sitting at a table in his office and asked me to close the door behind me and have a seat. The division director handed me a piece of paper and said, "I need to read this." I read the paper. However, I was very confused about what I was reading. I remember saying, "This must be a mistake. I've already been cleared by DHS several times during my 2 internships and when I worked as a technician in the same program." I was told by one or both of them that if it's a mistake, I'm sure we can clear it up quickly. However, for today, we're going to have to ask you to leave the premises. Gather up your personal belongings from your office, and we will escort you out. I remember being very emotional as I was escorted back to my office by my supervisor to gather my stuff and then escorted out the front door. I was in utter shock that the very same building that I once called home and a tribute to saving my life was a place I no longer felt welcomed. Thus, the beginning my journey to attempt to fix a very broken system that seems to exclude the most qualified. Since that day, I have assisted dozens of others with this set-aside process. Many have been successful and some have not, like my friend Rachel. Rachel was one time a hardworking nurse. After losing twins, turned to drugs and alcohol to self-medicate. During the 5 years she struggled with substances, she had committed many crimes to feed her addiction. Rachel eventually got the help and support she deserved to stop using and start living. Since achieving recovery, Rachel has been working on getting back to nursing, and as many of us know, that can be a long and difficult process. In the meantime, Rachel had decided that working with people seeking recovery would be rewarding for her, and that her lived experience with addiction could definitely help another. She applied to work as a technician at a local substance use disorder program in the metro area. After being hired in October of 2021, of course, she received the dreaded document of disqualification. The employer had decided that they would continue to let her work while she pursued her set-aside. Rachel worked diligently over the next few weeks to complete her 147-page set-aside. Yes, I said 147-page is what she ended up with, all of the required and redundant paperwork. Rachel submitted her set-aside to DHS, and unfortunately, in January of 2022, she was denied and terminated from that job. The substance use disorder services field in Minnesota faces massive work shortages, and it's time we let those most qualified get to work. Thank you for allowing me to speak today.
Thank you, Mr. Anderson, for sharing your experiences with us. Next, I have Ms. Chelsea Swartz. If you'd like to introduce yourself and begin your testimony, please.
Good afternoon. My name is Chelsea Schwartz. I am also a person in long-term recovery, currently working in a substance use disorder field in Minnesota. I remember getting my first letter of disqualification almost 2 years ago and feeling overwhelmed as well because of my 3 fifth-degree drug charges that started back in 2008. And a misdemeanor theft charge. I was disqualified to represent a group of female individuals who were new in recovery, and therefore sat back down and took a job moving furniture, which I definitely wasn't qualified for, but my family owned it, and I thought that was my only option to become self-sufficient. The therapeutic value of one addict helping another is without parallel. I know some of my biggest mentors and people that led the way for me were the people that I watched what they were doing and how they got there. And that's also a really great principle that I've learned in the program from Narcotics and Alcoholics Anonymous that dates back to 1938, right? So we know that this program is out there saving lives, and I also work in the field and see the shortage of people every day. It wasn't until I got a little bit more immersed in the recovery community that I was made aware of this set-aside process. Didn't know what it meant or how to do it, but I knew that my heart was in the field of recovery and helping other people fight this battle and the disease of addiction. So thank you for hearing me today. I do know that the shortages are great. We're working, 12 to 24-hour shifts sometimes, so these vulnerable adults at our facilities are not getting kicked out and redirected elsewhere because we are always short-staffed. Thanks for hearing what I have to say.
You're welcome, and thank you, Ms. Schwartz, for sharing your experiences with us. Is there anyone else from the public who'd like to testify on this bill? Hearing none, I will go to any member questions or comments. I'm not seeing anything, so Representative Edelson, I want to say thank you for the work you've been doing on this bill. I know this is something you've been doing since before we started session. Please offer your closing comments and then renew your motion.
Thank you, Mr. Chair. And we did adopt some of the recommendations. If you just look through House research, I'm not going to bore you with them, but it is to streamline the process more. I just want to end with saying no one person is all good and no one person's all bad. Each one of us at these tables have made mistakes. And I hope in these moments today and in these places of power that we do something that will really help people. Thank you.
Thank you. So Representative Edelson renews her motion that House File 1172 as amended be referred to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Opposed, say nay. Motion prevails and House File 1172 as amended is re-referred to the Human Services Finance Committee. Our next bill will be House File 2058. Chair Hassan, please welcome to the committee. Since Chair Hassan is not a member of our committee, I will move to refer House File 2058 to the Human Services Finance Committee. We have about 15 minutes for this bill to let the members know we are going to be going past time so that we can get to our final bill. So we'll have about we'll be able to go to about 20 to 3 today. So with that, Representative Hassan, welcome to the committee. Great to have you here. Please go ahead and introduce your bill.
Good afternoon, everyone. Thank you, Mr. Chair and members, for the opportunity to present House File 2058, which is the Cultural and Ethnic Minority Infrastructure Grant Program. As we all know, there are disparities in accessing mental health treatment and services, and these disparities are partially related to negative associations to admitting to struggling with one's mental health or seeking services, and also lacks the cultural diverse providers that we need. The Cultural and Ethnic Minority Infrastructure Grant Program helps providers from cultural and ethnic minority populations and the LGBTQAI+ communities to build out their capacity to serve their communities. There's a long list of grantees, and I'm sure this is in your packages. If I just want to say some out loud, some of the previous grantees that got the mental health grant are Change Inc., Center for Victims of Torture, the ones that got the SUD only Hmong American Partnership, Lifehouse, the ones that got the integrated mental health and SUD grants, American Indian Family Center, Avivo, and the list goes on. This bill places these grants into statute and increases the funding. This bill also recognizes the benefit of including elders and healers into treatment services, and then it also funds community health workers program to build a new model of educating community health workers to do mental health, education and awareness. In my previous life, I worked in the county. I've worked in the private world, but I've also worked in nonprofit. And my decision to transition from private to nonprofit was I was working with Prairie Care, which is a privately owned agency, and I was only working with mainstream folks. And my frustration was I got into mental health because I really want to help people who I can relate to their experience, that I thought that I understood where they're coming from, people who are coming from war-torn countries, people who have, have faced racism and all of that. And I wasn't seeing that. So then I'm like, okay, so where's the breakdown in here? And my transition to nonprofit was, I was doing nonprofit in just doing education and awareness. I realized that many people don't know services that are available, and many people think when you talk about mental health services, they think about, some fancy, shrink that asks you to lay down on a couch and just close your eyes and just like talk about. That's not the mental health services. Mental health services are, different at every community. Some folks, our native folks use healers. Some of the African people use healers. So in this grants that it's doing few things to include healers and elders. It's also using community health model, which has been successful in the past. It's also one of the things that I'm super excited about this grant is when I read about the grant was the IRTS facilities, the children's residential and adult residential. I remember when I was in the county, I placed someone in IRTS facility that didn't speak English, and the IRTS facility next day called me and said, what do we do with this person? I'm like, why are you asking me that question? My only job at the county was to place them, not to, continue providing care. I'm like, from here on, they're your responsibility. They're like, yeah, but they don't speak English. There are no interpreters. So having, having a grant to pay for that is really, really key and crucial. And with that, I know that there's more we need to do, access to mental health and chemical health. And this is the beginning. And I also know that there's another bill that we're going to hear today, but I have testifiers who are much more qualified than I am who are going to walk us through this bill. Thank you.
You're welcome. Thank you, Representative Hassan. Sue Abner-Holden, if you'd like to introduce yourself and begin your testimony, please.
Thank you, Mr. Chairman, members of the committee. Sue Abner-Holden, Executive Director of NAMI Minnesota, and I'm here on behalf of the Mental Health Legislative Network to urge your support for this bill. We are referring to this as our equity bill because we know that people from culturally and diverse ethnic communities don't have the same access to mental health treatment, and this bill is really a step forward to addressing the disparity by strengthening our culturally specific providers and by working to educate diverse communities about mental health. I'm going to skip over CMIG because we're going to have testimony on that, but I just want to say that really we've seen a lot of research about the importance of infusing cultural practices into treatment, and so we want grants to be available to providers to support this practice. We also looked at if a provider is white, for example, who's treating someone from another cultural community, it might be beneficial to seek advice from a mental health professional from that cultural community to be able to serve them better. So we would pay for consultation. Community health workers are trusted members of their community and can facilitate access to services and improve the quality and cultural competency of service delivery. So we want to create a certificate program in mental health so that they can provide that education and support. And as we have heard from IRTS providers who don't have a way to pay for translators and interpreter service, and so this funding will help them. As a state, we need to step up our efforts to reduce disparities in the mental health system and promote equity, and this bill is a good first step. Thank you.
Thank you, Executive Director Abder-Holden. Next, I have Dr. Jessica Garneau. Garneau. Thank you for correcting me. Go ahead and introduce yourself and begin your testimony, please.
Thank you, Mr. Chair, and to the members of the committee. I am Dr. Jessica Garneau. I am the Clinical Director at the American Indian Family Center on the east side of St. Paul, and I'm a recipient of the CMIG grant that you're talking about today. As we know, mental health issues affect people of all races, ethnicities, genders, and ages. However, research has consistently shown that certain communities face disproportionate mental health challenges due to systemic barriers and social determinants of health. These include, but are not limited to, issues around discrimination, poverty, lack of access to health care, and cultural stigma. To address these challenges in our BIPOC communities, it is really essential that we provide mental health and chemical dependency services that are culturally specific and sensitive. Culturally specific mental health and CD services really recognize the unique experiences, the values, and beliefs of diverse communities and are designed to meet their specific needs. To provide that quality, culturally specific service, it is also necessary to build up our culturally specific mental health and chemical dependency professionals to join the workforce so they can provide this much needed support to our communities. As you know, there is a really troubling shortage of mental health professionals overall, but that is also compounded significantly within our BIPOC communities. We have a large portion of our mental health professionals who are retiring from the community and a lower amount of people actually entering the field, and which is increasing that gap in the mental health and CD workforce shortage. So this grant has been very essential in trying to address that and provide supervision from a cultural lens. So while you can receive supervision from a person who is not from your culture, there are specific ways in which supervision looks different within that cultural worldview, because without that, you can cause harm in the supervisory relationship, which causes harm with providing quality care to the people that you're serving. We also really work at integrating those traditional values, knowledge, and ceremonies into all of the Western modalities that we provide. We provide monthly healing ceremonies and biweekly educational and healing ceremonies. And I cannot tell you how impactful it has been with the addition of that, our ways to improve mental health. I don't know how many times I've had somebody come up to me after one of these ceremonies and say, thank you so much, we need this so much. And they've actually been willing to enter mental health when previously they never would have before, because they can trust that we're going to be able to understand their needs. Just as what has been said earlier, the fear of entering mental health and chemical dependency and the removal of our children is a real fear, and the statistics behind that show that. So I really feel like with the introduction of those particular pieces that we're able to provide better care, and we're able to also address those people who are talking about suicide. We have had multiple people come up from these ceremonies and talk about feeling suicidal, and we've been able to intervene before it's been too late. So those are a little bit of it. Some of the barriers for mental health professionals, though, are very significant. There are financial barriers. There are issues with passing the licensure exam, and there's significant fees related to getting all of that through. And without having that culturally specific supervision in this grant, it makes it even harder. Our mental health people that are able to provide supervision are limited, very limited. And so we want to be able to provide all this, but we have to balance that out with all the other needs that we're supporting. So I will say that this grant has really been essential. I've been really proud of the people that we've been able to grow and put out into the mental health workforce. But in closing, I really want to urge you to prioritize the funding and continued support for this grant so that we can ensure to increase our ability to provide quality, and that's an important word, quality, culturally specific mental health professionals who really can better address the needs within our disparities. Thank you.
Thank you, Dr. Gernal. Next, I have Dr. Willie Garrett. If you'd like to introduce yourself and begin your testimony, please. Thank you for being here today.
Thank you, Mr. Chair and members of the committee. My name is Willie Garrett. I am a psychologist, and I've been a psychologist for over 40 years, and I am the president of the Minnesota Association of Black Psychologists. Dr. Gourneau gave such an excellent presentation that I won't repeat all of those items. But one thing I do want to emphasize is that that issue of the severe shortage of providers of color. It's at a crisis point at this time, and I'm not sure what we can do without needing. Getting a lot of help with this issue. Let me give you an example. With the black psychologists, 5 years ago, we had 25 black psychologists in the state. We now have 20. And what happened is that many of the black psychologists got their degrees during the time of affirmative action, and now many are near retirement age. In the next few years, we're going to have at least half retiring. There are 6 African-American child psychologists. And you think about all of the thousands of children of color, not just black children, but children of color. So we're really at a crisis point at this time, and this bill will help to create that infrastructure for supporting and mentoring providers of color. Not just, I shouldn't just say providers of color, but LGBTQ providers as well, providers who serve the most underserved populations in the state and the most highest need populations in the state, and providers who serve people from around the state, because there are people of color in every county in the state. In every county, there are people of color. And so there's a huge rural issue with that as well. But I want to thank you for allowing me to speak today, and thank Dr. Gorno for such an excellent presentation as well. Thank you.
Thank you so much, Dr. Garrett. Is there anyone else in the public that would like to speak on this bill? Not hearing anybody, thank you so much, both of you, for being here for the testimony today. I very much appreciate it. Members, any questions or comments? Representative Baker.
Thank you, Mr. Chair. And I think the bill author here is certainly recognizing something that I have seen for a long time serving on the ORAC Council. We have a lot of presentations with our BIPOC community. We have, with our granting with DHS into the behavioral health side of things, been, again, awarding the licensing fees, the settlement dollars that we're just starting to get now with the opioid settlements. And we are and the reason I bring this up is I want to share with you the reality of DHS and their capacity of what they can handle. And I'm cautiously concerned that when we do bills like this that are very kind of siloed and very focused on a certain community, a certain healing arena, it's good. But I think I want to make sure we as legislators be careful with how we do this in a way that is just so focused that it creates a lot more work for the folks who actually have to do the work, and getting the grants out in a way that's very, very impactful. And I just say this because of my personal interaction right now with DHS in these areas. So I like this kind of work that we're doing. I want to support this, but I also, just as legislators, we need to make sure we do a better job incorporating the current process and making sure we get the communities of color and the LGBTQ community and the folks that need this, and we have to focus on this. But it does really stress out those folks doing this. And I'm a Republican talking about protecting the agency. I know it sounds weird, but I'm seeing it firsthand. That's why I bring this up. I have to be honest with our colleagues. We sometimes create things that's a lot more work than what we are intending to do, but we want to get the work out there. So I support the bill, Representative Hassan, and I want to make sure we do this. I just wanted to put it out there to say, let's be very, very careful about how this continues to work in this manner. It's easy to just ignore the work that they're doing now at DHS, and it's their problem. We're going to flip it over to them. I get it. They don't have enough people already. So I just want to just say that as sort of a, let's keep our eye on the ball with this to get our objectives done. But I'm seeing a different uniqueness of this. And again, I think we can do a lot of good things here, but they are at I think a breaking point too. So I support it. Let's make sure that we keep thinking about this as we go forward. Thank you.
Thank you, Representative Baker. Before I go to Representative Hassan for her comment, I will mention that I know that the department has been receiving and working these areas. I do know they've been doing a good job of getting them out. I know that they at times have got a lot on their plates, but I think they're doing a good job of paying attention to these things and executing them well from what I've seen that they've been given so far. Representative Hassan, your comments.
Thank you, Mr. Chair, and thank you, Rep. Baker. You and I agree on many levels when it comes to mental health and chemical health, and I thank you for your support. One of the things that I just want to highlight is that if it's actually more work for us legislators and community folks to continuously ask for change and continuously demand that we change things. If this was as easy as pie, I would have just say, hey, DHS, you take care of this and we don't have to worry about it. We could have just said, include this in DHS funding and it's done. And as we know, that's not the reality. The reality is that we have disparities, and these disparities exist for a reason because there are systemic issues that we cannot ignore. And this is what that says. I will share with you a small story, and then that's my final comment. I used to do, when I transitioned from the county to private world to the nonprofit world, I worked with a small entity, nonprofit organization in, it was a clinic in Maplewood, and they saw a lot of immigrants. So one day, one of the, patients there came in, and she said she wasn't feeling well. She said she has a headache. She's been to the doctor multiple times. They keep telling her there's nothing wrong with her. Just take Tylenol. Tylenol isn't working for her. I asked her, I said, when was the last time you drank water? She said, I don't drink water because water just makes me nauseous. At that time, I knew she was dehydrated. She's been to the hospital multiple times. She even went to the ER. I told her that, what flavor fruit do you like? She said, strawberry. I got those Crystal Light and add 3 bottles of water. She drank 3 bottles of water, took a nap on the couch, woke up, and swore up and down that I'm the only doctor on planet Earth that she believes in. and I only knew that because I knew many of our immigrant communities don't drink water. They think that drinking tea and juice are considered water. So there is a knowledge based that we're really missing out when we don't have, these providers who are coming from minority communities included in this process. With that, I hope everyone supports the bill. Thank you.
Thank you, Representative Hassan. And with that, I renew my motion to refer House File 2058 to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Those opposed say nay. The motion prevails and House File 2058 is referred to the Human Services Finance Committee. Thank you, Representative Hassan.
Thank you, Mr. Chair and member.
You're welcome. Our final bill for this part of the day is House File 1438 from Chair Vang. Chair Vang is not a member of our committee, so I will move to refer House File 1436 to the Human Services Finance Committee. I also understand, Chair Vang, that you have a A2 authors amendment. I will move the A2 author amendment if you'd like to explain that to us, please.
Thank you, Mr. Chair and members of the committee. The A2 amendment just makes technical changes and it adds eligibility for the supervision grant program.
Very good. Any questions on the author's A2 amendment? Hearing none, all in favor of approving the author's A2 amendment signify by saying aye. Aye. Opposed? Motion carries. We approve the A2 amendment. So, Chair Vang, if you'd like to explain your bill as amended, please.
Thank you, Mr. Chair and members. This is a workforce bill. As some of you may already know, addressing shortages in the mental health workforce has been a priority of mine for a number of years. It's not news, as mentioned earlier, that we are experiencing a severe shortage in the mental health workforce and a male distribution. With increased needs, we need to increase the workforce. Mental health providers are significantly underpaid compared to other providers with the same level of education, preparation, expertise, and licensure. Between 2007 and 2014, only about 49% of those completing their graduate education to become a mental health professional actually obtained their license. We also know that 88% of our clinicians are white. The past 2 years, I've carried bills to address both the numbers of people in our mental health workforce and its diversity. We increased funding for the Mental Health Professional Loan Forgiveness Program, paid for BIPOC mental health professionals to become supervisors, provided grants to providers treating people from underserved communities so they could provide supervision for free, and allowed supervision to be conducted virtually. In addition, we now require mental health professionals to take continuing education to become culturally informed, and we require the boards to have diverse membership. And lastly, we created the Culturally Informed and Responsive Mental Health Task Force to continue to study this issue. And I want to thank the committee and the legislature for their support on these initiatives. And this year, I have introduced House File 1436 to build on this work by continuing funding for the 3 programs I've just mentioned, and to ensure that under the MERC program, providing care in the community is allowed, creating a pediatric primary care mental health training program, creating a Grow Your Own program to support people in obtaining a master's degree, creating a training program for people working with youth with a mental illness, and funding an additional psychiatric residency slot. In addition, we want to create a mental health and substance use disorder education center focused on increasing the number of professionals, practitioners, and peers working in mental health and substance use disorder treatment. We cannot meet the needs of our community without paying attention to our workforce, and we hope to make it happen this session. And with that, I'll yield my time to my testifiers.
Thank you, Chair Vang. First we have is Executive Director Sue Abderholden, if you'd like to introduce yourself. And I'll let the committee know that we've got a hard stop in 10, so at 1:45 I will be taking the vote. Go ahead.
Thank you, Mr. Chairman, members. Sue Abderholden, Executive Director of NAMI Minnesota, and here on behalf of the Mental Health Legislative Network. I was just going to briefly go through some of the sections of the bill that maybe you weren't so aware of. One, again, sections 1 through 2 is making sure that we can work hours out in the community and not necessarily within clinical walls to count for the MERC program. We recognize that mental health professionals have to obtain a certain number of supervised hours before they can become licensed, and during this period of time, they would now qualify for the loan forgiveness program. Section 5 adds another psychiatric residency slot. Section 6 you're going to hear more about, but I just want to remind people that President Eisenhower's seminal mental health report noted that we had a shortage of child psychiatrists, so we've known about this for a long time. Section 7 continues the funding for the program that pays for the education necessary for a BIPOC or underrepresented community to become a supervisor. I will say that since this program passed in 2021, we saw 215 mental health professionals go on to be able to be supervisors, which I think is really great. And that will lead to about roughly 400 students being able to get supervision. Section 8 is the new idea to create this center within the Department of Health. We actually looked at Nebraska as a model whose legislature did do such a thing, and what they saw that in 10 years, the number of providers increased by 39%. So by having an office that really focuses on this issue, it can be effective. Section 10 is really the grow your own approach, so someone who's already working in the field, helping them get a master's degree. Section 11 is training for people who work with youth. We obviously need a lot more people working with our youth, but we also want to make sure that we are training them in a way that makes them be most effective in reaching these children. And then Section 12 increases the fund for the loan forgiveness program, which we know has been very effective. So I really want to turn it over to the people who have been most impacted by these programs, but I just want to say that the things that we have done, thanks to your leadership and to your support, have actually worked, and we need to continue to build on them. Thank you.
You're welcome. Thank you. And next we have Bahua Yang, and I apologize if I messed up on your first name.
You're correct, Mr. Chair.
Oh, thank you. Welcome to the committee. Thank you for being here. Please introduce yourself and begin your testimony.
Yes, good afternoon, everyone. Thank you, Chair Fisher and committee members. My name is Bahua Yang. I'm the Vice President of Community Mental Health and Wellness at the Wilder Foundation. I'm here to testify in support of Representative Vang's House File 1436, addressing mental health care workforce sustainability. But before I talk about that, if you're wondering what type of provider, what kind of creature CMIG produces, which is the previous bill, I am one of them. So I am living, breathing proof that we support good providers. I went from being a participant in CMIG to being the person who ran CMIG for my organization to being vice president. The Wilder Foundation is a community mental health and substance use disorder treatment provider and a certified community behavioral health clinic, or CCBHC. And part of our work has focused on being reflective and responsive to the individuals and the families and communities that we serve. It's our strong belief at Wilder that our providers and our leadership must reflect the people and the communities that we serve. We also know that how we show up as a service provider and as an employer in our communities are equally important in moving the needle for the people throughout all of our communities. This is not just about doing the right thing as a provider. Honestly, it's also a smart business decision. The work comes with lots of challenges: financial, sustainability, and human impacts. In this national workforce crisis, our mental health system is competing to attract and keep workers in a field that can be at times stressful and usually under-resourced. We have additional opportunities in front of us to take a multi-pronged approach to addressing both the sustainability of the system and our ongoing workforce challenges. I won't repeat the things that Sue has already talked about, but know that this is really, again, about bringing more sustainability to the system so that we can attract and retain good talent who want to do all the right things for our communities. We also need to be able to expand our MERC dollars to include training providers outside the physical clinic facilities. Minnesota and our entire state our entire country has moved to providing treatment to people beyond the four walls of a clinic, to serving people in places that make most sense to them, such as in the community, in schools, in homes. And we have to update how we support clinical training in order to catch up with what we are actually doing in practice now and into the future. Over 20 years ago, we began talking about the workforce shortage that we were soon going to face in the mental health and SUD treatment field. And despite many collective efforts, we've discovered that we haven't done enough. I want to applaud Representative Vang and many of you in this room who have worked so diligently to move the needle on workforce issues these past 2 years. We need to ensure that this critical work continues to live and is sustained beyond any of us in this room. Investing in an education center dedicated to growing and supporting our mental health and SUD workforce will add to this long-term sustainability. And hopefully in another 20 years, we'll be having a different conversation about the whole new generation of talented professionals who are advancing mental health and SUD treatments that are new and unique to their time and not the issues that we failed to solve. Thank you so much for your consideration and the support and leadership that so many of you in this room have already provided.
Thank you, Ms. Yang. Next, I'll go to Amanda Schlesinger, and we've got about 2 minutes, and then we'll have to go to the vote.
I'll keep it focused. I'm a child psychiatrist on the faculty of the University of Minnesota Medical School. I'm here to...
If you could also please introduce yourself.
Oh, I'm
I
so
apologize.
sorry. Yeah.
Okay, I didn't mean to rattle you there, Brad.
So I'm Amanda Schlesinger, and I'm an assistant professor of child and adolescent psychiatry at the University of Minnesota Medical School. I'm the medical director of the Consultation Liaison Psychiatry Service at Masonic Children's Hospital as well. So I'm here to voice my support for this bill, which will support important initiatives for addressing our state's mental health care needs. So at work, I see youth in crisis every day. So every day, I think about ways we can deliver better care more effectively to the people who need it most. And one of the best ways we can do that is in the primary care setting, with the regular providers families know, trust, and see regularly. And this is where mental health concerns are often mentioned first. 90% of children in the U.S. regularly see primary care. However, primary care providers don't always feel ready to address and treat mental health problems compared to other medical issues because their training doesn't necessarily include deeper experience in mental health care. Faculty like me trained in psychiatry and psychology want to join more in training our primary care clinicians to handle their patients' mental health needs. There's a serious shortage of child psychiatrists. We can't have enough of me. We want to share our knowledge base more effectively with frontline providers to get care to kids faster and train a more confident pediatrics workforce. So several years ago, there was a working group created that I joined at the university. It brought together faculty from psychiatry, family medicine, nursing, and pediatrics. We were very fortunate to get grant funding for an initial pilot program in 2020. We embed psychiatry and psychology faculty directly into primary care clinics to teach mental health skills to future pediatricians, family practice doctors, and nurse practitioners in real time as they see their patients. We work alongside their other faculty teachers, so as they learn about asthma and infant nutrition, we also teach directly about depression treatment or resources for ADHD. So they get coaching directly from a specialist to rapidly improve their comfort and confidence in this area. The funding outlined in this bill would allow our program and program like ours to continue to expand and improve to better meet the needs of Minnesota's youth. Additionally, as faculty in the larger Department of Psychiatry want to advocate for the funding of an initial psychiatry residency position included in this bill. Psychiatry is an increasingly competitive specialty, and we have far more wonderful applicants than we can match into our existing slots. And doctors who train here often stay and practice in Minnesota, increasing our young workforce. Thank you very much.
You're welcome. Thank you for your testimony. With that, I'll renew my motion to refer House File 1436 as amended to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Opposed, say nay. Motion carries, and House File 1436 as amended is referred to the Human Services Finance Committee. Thank you, members. We will be reconvening at 6 p.m. today. With that, we are on recess until 6.